what time it is. Marvin Devine, Huber, Axel, and you know how we do. Yeah, I got the juice. Big game cool, make them look like cool. Always play cool, that's the biggest rule. Forget what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Huber, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go.
Good evening, good morning, good afternoon, wherever you're watching, and welcome, and I mean welcome, to another episode of Kidney Hub East Africa. I am half your host, Stevethekidneynurse. Welcome. Today, we have an excellent show for you. And in fact, if you're watching from East Africa, you're going to want to stay and watch this show, especially if you're a kidney warrior. Wherever you're watching from across the waters and you undergo kidney dialysis, you're going to want to see this show. If you never heard of infection control, you're going to hear about it today. Our topic today is infection control in the dialysis clinic. What you should know. And help me talk about this, and my co-host who also undergoes kidney dialysis is none other than Moses Kennedy, aka the Kidney Ambassador. So let me give my co-host a warm welcome all the way from Kisumu, and I may say that wrong, but Kisumu, Kenya. Hey, Brother Moses, how you doing?
Well, Brother Steve, I'm fine. Thank you so much.
It's good to see you as always.
Good to see you too, brother.
Yeah, here we are, another week, another show. And today we're talking about infection control in the dialysis clinic, what one should know. Brother Moses, by you being one that undergoes hemodialysis, what do you know about infection control? I mean, what is your understanding, or is that even, excuse me, is that even talked about or brought up in Kenya or where you receive your treatment at?
Thank you so much, Brother Steve. Having been on different dialysis units, I've seen it many a times that any subject to do with knowledge and education is something that is really sidelined. And so is infection control as well. Now, even though this one happens, it is very important for everyone, from the care team to kidney warriors, and then to caregivers, to be acquainted of basic information regarding infection control, because these are one and many more things that can put the life of a patient at danger within no minute, especially when it ends to be a medical emergency, Brother Steve. So yes, infection control is just a way, a collective nature and responsibility of curbing disease or germs from spreading from one place to the other. However, Brother Steve, I must acknowledge that even as we try to strive for a sterilized environment, the aim and the main goal is normally not to make the germs move closer to the access of every patient. Back to you, Brother Steve.
Okay.
Yeah.
So for those who are watching, welcome. Let me see if we got anybody in the comments. We got P Teach is back. Welcome, P Teach. I appreciate you always coming. Happy Easter to you as well. Thank you. But let's talk about infection control. Let me just give a broad overview, and then if you're watching this broadcast and you see some of this or experience, please share your experience. So, to our brothers and sisters in East Africa who this show is geared toward, we hope you're watching to get the most out of this that can help you navigate your way through this journey. Now, infection control and why it matters for dialysis patients is very important. Infection control means or equals steps to stop germs. Plain and simple. Steps to stop germs. We're talking about bacteria. We're talking about viruses, fungi from spreading. Now, this is real. This is real. And Brother Moses can tell you that he's been hospitalized. He's been hospitalized several times for an infection. And not on his own. It could have been caused by healthcare workers not washing their hands when they changing his dialysis catheter dressing. Now, why does this matter for dialysis patients or people on dialysis? People on dialysis are at a higher risk. They are at a higher risk because treatments, we had to get access to the bloodstream, whether you have a catheter or you have a fistula or graft in your arm, which we have to use needles to stick. And then you have some patients that may be in East Africa that may be on peritoneal dialysis. And you got to watch out for that so the peritoneal cavity, you don't get peritonitis. And the fact that many people undergoing kidney dialysis have weaker immune systems. Now, let me tell you something, and take heed to this. Infections can be serious and life-threatening, especially when we're talking about bloodstream infections, or if you're undergoing peritoneal dialysis, peritonitis. Now, the good news to this, yes, there is good news, that simple practices reduce the risk of infections. Brother Moses, anything you'd like to add to that?
Oh, yes. Simple practices reduce the risk, and those practices must not be undermined. However little or small they might look like. Something like washing hands from one patient to another, Brother Steve. Yes.
All right, that's all you got for that? Okay, Brother Moses, before I go on to put up some practical prevention steps for all dialysis patients, let me just share something on screen. So here goes some infection control tips for kidney patients in East Africa. One that you mentioned, Brother Moses, wash hands every time you can. You know, if you go to dialysis, if you're touching the doorknob, wash your access after the restroom, and make sure staff are washing their hands as well. And effective hand washing is 20 seconds or more. 20 seconds or more. All right. Keep your access site clean. Wear your mask in the clinic. Report fever or redness early, especially if it's coming from your access. Avoid touching your access site with your bare hands. And also clean your supplies regularly. whether it is blood pressure cuff, you using a thermometer, whatever you're using that you had to come in contact with, there's a medical device. Make sure you clean it regularly. Now, Brother Moses, let's talk about some other practical tips, preventions that our brothers and sisters in East Africa and across the world can do, all right, to reduce infections. Again, one of the most important things that I can't stress enough, hand hygiene. Something that you said, washing your hands with soap and water for 20 seconds or more before and after touching your access or dialysis supplies. Now, if you're in East Africa, if running water is limited, use alcohol-based hand rub. That's at least 60% alcohol when available. Brother Moses, do y'all have hand sanitizer in Kenya?
Oh yes. Oh yes. We have hand sanitizer. But then I also on the watch out so that my care team try as much as possible to perform hand hygiene, because I normally refer to as somebody make your hands as clean as it is prepared to take a meal, as if you want to take a meal. That is the most and the best way to know if your hands are clean. But you know, Brother Steve, sometimes as human beings, there is this tendency of maybe the care team that just dodging the law because that is what the law requires. So they just go by the tap and then just soak their hands within 1 second, pull a serviette, and then dry it off without using soap and without adhering to the timely that is required, 20 seconds. So this happens within 1 second. You can imagine it doesn't achieve any goal. As much as they would troop towards the tap, it is just to prepare you psychologically that I've washed your hands. So yes, they do it. And again, the problem now is, do they do it the right way? So these are issues that I want to encourage kidney warriors all over the world. You can try and get as much as possible the best ways to escalate this, so that, because at the end of the day, it is the patient who suffers. If you keep quiet, there is nothing to gain. If you raise your voice, there is a lot to gain. So the choice is up to us. Back to you, Brother Steve.
You're absolutely right, Brother Moses. However, let me ask you, I'm not sure how systems are run over in Kenya when it comes to dialysis. So if one goes to dialysis, say at your facility, and they speak up and say they see somebody not washing their hands, a staff member, or using hand sanitizer, and they say something, are there repercussions for someone speaking up? How was that handled?
Oh, yes. Let me elaborate this. Uh, in most cases, Brother Steve, from our constitution to any form of governance and any form of just say to our local administrators, the law is well articulated. The problem is implementation. And there are even rules that regulates this, that you need to remind your care team to do that. But then you see, sometimes in a case of public hospitals where there is a lot of corruption within systematic corruption within the Ministry of Health, sometimes affects these and many more policies to be affected. Number one, you realize a hospital might lack sufficient supply and more so crucial consumables like gloves, and then the taps are running dry, no soaps provided. Even if it provided, it works for a few days and it is over. So sometimes even as much as one wants to question all this, then you see you are sort of clipped. So in that scenario, that is scenario one. But there are cases where the healthcare decides to choose negligence. So we must also talk about that. You realize that a facility has everything that it takes to deliver, but then the care team decides not to follow the law, instead to dodge it. So there are two scenarios. Now, when everything is available, consumables are there, the environment is conducive, then it is easier to escalate because most units are standalone dialysis units that they are also keen on profit making. Yeah. So at least your voice shall be heard in many cases. If you are consistent and you are accurate to what you are trying to address. Yeah. However, there might be some bad attitude towards a patient who does that because, number one, sometimes some facilities lacks well-equipped staff as far as training and education is concerned. Most of them learn the process of dialysis on job, and beyond the daily activity that after washing, you suck, you check, and the knowledge ends there. So you see, this one also risks the life of a patient, Brother Steve. So those are two scenarios. Back to you, Brother Steve.
Hey, Living Life 4010. I haven't seen you in a while. Happy holiday to you. Welcome. It's good to see you. Well said, Brother Moses. You said a handful. But one thing that I want to encourage our brothers and sisters in East Africa and abroad, and even here in the United States, do not touch your access unnecessarily. What I mean, if you got a scab that's developing over the site where they remove the needle from your access. Do not pick at that scab. Let it heal on its own. And don't, when you go back to dialysis, don't let them stick you right there in that same area where that scab is still forming. Have them move up. Have them move up. So don't touch your access unnecessarily. Keep fistula, graft, and catheter sites covered, excuse me, and avoid touching or fiddling with the dressing. Now here, Brother Moses, in the United States, oh, thank you. Brother Moses, here in the United States, what tends to happen when they put the needles in, and let me see if I can find a needle. We got one needle right here. Brother Moses, as they put the needle in the access, what tends to happen, instead of putting the gauze over where the needle went into the access and cover that part up, they cover it up with tape. And a lot of times that tape may be in their pocket, fell on the floor, sitting on the ledge. And you know, the tape has adhesive on it, which attracts dirt. And if you put in that tape, not a sterile gauze, but the tape over the site to hold the needle down, then there's a probability that those germs can get into your bloodstream because of the entry site. The entry point is covered with tape and not a sterile gauze. Also, recognize and report symptoms early. Fever, out of nowhere, chills, redness, warmth, swelling, pain, or pus at your access site, whether it's your fistula, graft, or your catheter. If you see any of this at the access site, you make sure you let someone know right away. Brother Moses, anything you want to add to this before we move on?
Not much, Brother Steve.
Okay. Also,
not much. Kind of, you've exhausted it.
Okay. Also, I failed to mention to say, if you develop a new cough or shortness of breath, especially if you're a peritoneal dialysis patient, cloudy peritoneal fluid, or abdominal pain, call the clinic immediately. Call the clinic immediately. Also, something that many people don't want to talk about, but let's ask Brother Moses if this is offered at clinics in Kenya. And if they are, do you got to pay out of pocket for this? And now if you do, this is diabolical. Vaccinations, especially hepatitis, flu, pneumonia. Brother Moses, do they offer that in Kenya? And if they do, is it covered under the health insurance or is it out-of-pocket payment?
No, It is there if you request. Vaccinations are there if you request, and it is a private arrangement, including the mandatory ones like hepatitis B and so forth. But then, funnily enough, nobody cares until when you ask for that services, because it is not included in the package that is being provided by the insurance. So yes, for those who are aware and can afford, I've gone as that far to get vaccination. Yeah. So that is the current state.
All right. All right. Wow. Now, if you in East Africa and you get put on oral, meaning taking it by mouth, antibiotics, make sure you follow the prescribed treatment regimen and do not self-treat or stop early. Also, something common in East Africa, and Brother Moses can elaborate, is home remedies. Avoid traditional or home remedies on the access sites, ointments, herbal paste, unless advised by the clinic. Brother Moses, you right there in the thick of it. Can you speak on that, on home remedies people may put on their access sites like ointments or herbal paste?
Oh yes, there is a lot of myth regarding home remedies and self-medication, because people tend to believe in the solutions that can be quick fix, and this is why the herbal space gets in to fill in that gap. However, because of poor awareness, low-income communities, and basically one just picks on anything that can give him or her a quick fix, including believing in prayers for healing. So you realize that those who are engaged in these services, these vices, they are good at speaking and marketing those products. And because you are yearning for an answer, a quick fix, you will fall to those tricks. And then thinking that maybe you've been on dialysis for 3 years and you don't see any change. And Brother Steve, funnily enough, there are so many patients who ask me, some even call me kidney specialist. I was just getting a message right now that kidney about some topic, and the guy was referring me to kidney specialist. So maybe before I continue, let me make it clear that I'm not a kidney specialist. I'm also battling kidney failure, and I've been on dialysis for 10 years now, and we are still here to go. No giving up. So I think it is clear on that. So when it comes to quick fixes, people tend to believe that what is being given, the treatment options that are available are not working for them, because somebody complains today, I went in walking, I'm unable to come out walking. I need to be wheeled out. So, and put aside that, there is this false denominations, false beliefs that prayers can also work magics. I am a strong believer in healing, but then we should not mix these things in that manner. You realize somebody forgets about sessions and go camping in the name of prayer meetings that hopefully he will come again and will never go back to any dialysis unit. Then, because we also have unscrupulous men of the collar, they will lie to unsuspecting believers in the name of religion, that prayers are enough to heal them. And you see, somebody comes in hospital. The other day was just nice. Nothing has happened. He missed 2 sessions. He's almost getting rushed to ICU simply because of such reasons. So, Brother Steve, I think about herbal medicine and maybe alternative medication and self-medication, we just need another topic altogether, because this is where the problem really lies also in majority, because of lack of information.
I
Back to you,
agree with
Brother
you on
Steve.
that. I agree
Yeah.
with you about the lack of education and information. Absolutely. Now, Brother Moses, let's talk about some tips that we can share for our brothers and sisters in East Africa that undergo in-center hemodialysis. This is what they can do. 1, observe staff practices. Staff should clean hands, wear gloves, and change them between patients. If you see lapse, politely ask. Brother Moses, have you, in your experience, have you seen any staff move from one patient to another with the same gloves on?
Oh, yes. I've seen so many occasions. I've seen in some places whereby the entire session ends without the healthcare provider washing hands. I've seen also that. So you can see how grievous it is.
Wow.
And they do it. Yeah, they do it comfortably. But wait and see. That time when they are going to take
Patients, do they say
maybe a meal.
anything about it?
Sorry?
Do patients say anything about it?
Yes. For very few who knows what should be happening, we'll talk about it. But the majority who comes fall asleep until the 4 hours is over without knowing whether he gets quality dialysis or not.
Okay, wow. Also, another tip, keep the access on free. No blood pressure, No getting blood from your access arm or tight clothing on the fistula arm. If you got a catheter, which is right here, catheter care, keep dressing clean and dry. Keep the dressing on your catheter clean and dry. Cover the catheter. If you're going to shower, you make sure you get a shower protector. They sell them on Amazon. Cover the catheter when showering. Also, report any drainage, loosened sutures, or foul smell that may be coming from your catheter. Also, ask about clinic safety, how machines, water, and tubing are disinfected, how staff and patients are screened for hepatitis, HIV, and whether staff are vaccinated. Anything you want to say or elaborate on what I just mentioned, Brother Moses?
Oh, yes. I tend to believe that patient must also watch out very carefully, even especially during the changeover. That is, say, from the first session to the second session. In between that time, there is a lot of lapse in terms of hygiene measure and protocol. I mean, hygiene protocols. That there is a lot of gaps that happens in between. Sometimes because they are rushing to go home early, yet they reported to work late, but they want to go home early. You find them that instead of even sterilizing the bed properly, they just hurriedly pull off that linen and just place another linen. Or the machine is not well cleaned. Especially, I normally emphasize that they clean the sensor part, because there is also some backward flow of blood during treatment towards that sensor point. So if it's only the face that is clean and sensitive places like the pump, the sensor point are not cleaned, then still it is just a formality, not to curb infection control, Brother Steve.
Okay. Okay. Now, let's look at some tips for peritoneal dialysis. People who may do that at home. I know that is rare in East Africa, Brother Moses. But anywhere else in the world where you may be doing peritoneal dialysis at home, or you're thinking about it, here are some tips for infection control if you're doing that, PD. Clean technique for exchanges. You got to wash your hands, use the antiseptic recommended by the clinic. Perform exchanges in the clean, dust-free area. Also, your exit site care. Clean it as instructed by the PD nurse, often with antiseptic. Keep site dry and covered, and report any redness, tenderness, or pus. Also, the use of masks. I can't stress that enough. The use of masks. Wear a mask for exchanges if it's advised. Also, especially if you have a cough or you are in a dusty environment. Storage. Keep PD supplies in a clean, dry area and off the floor. And make sure you do not reuse single-use items. Now, Brother Moses, you may be able to elaborate on this, but let's talk about low resource and East Africa specific advice when it comes to the resources and how some of it are scarce. Water scarcity. Use soap and the cleanest water you can for hand washing. Also include alcohol hand rub as a substitute when water is scarce. Is that sometimes the case in Kenya or some parts of East Africa where the water is scarce?
Absolutely. And sometimes the water can be available, but the taps, the plumbing works is not up to date. So those challenges are commonplace here in Kenya. And I believe the option you also provided over there, that alcohol-based hand sanitizer can be used to rub your hands properly in places where there is absolutely limited resources. So yes, the resources, some places might not even be available, including the basic ones like soap, or if the soap is there, it is not antiseptic soap. So yes, there are such occurrence. It is a commonplace here. Thank you, brother Steve.
We had Tabitha, who's also in Kenya. She says the catheter, which I just showed, the catheter shouldn't be used anywhere else apart from the dialysis unit to prevent infection. Don't scratch, or I guess she was probably saying don't scratch around the site. Because see, what happens for many people here in the United States that have a catheter, hold on. Wait a minute. What normally happens, whatever they using to clean the area or whatever type of adhesive that's on that dressing can irritate the skin. And what a lot of individuals may do is scratch over the dressing, or maybe lift the dressing up and scratch under it. And that's a no-no, because remember, this is going under the skin, and then the tip rests in the back of the heart chamber. And Brother Moses, I don't know if I showed you this, but on this catheter, here at the end, you see those slits, those holes? That's where the blood comes through. And what happens, being that it sits in the back of the heart chamber, over time, it builds what's called a fibrin sheath over that site and can cause occlusion, meaning blood can't get in when we put a syringe on the end of this to pour your blood. Well, it's occluded. It's occluded. And so what here in the United States, what they use is a thrombolytic called cath flow activates, right? It comes in a little bottle in a powdered form, and we put sterile water in and mix it up and draw up pretty much 2 cc's, and and we put it in the limb. We inject it in the catheter limb and let it sit. It's supposed to go all the way down and sit for about 30 minutes, where what's happening now is starting to dissolve the clots that are occluding these holes. And so after 30 minutes, we come back and we aspirate, and the catheter is working. However, this is only a temporary solution. It's only temporary because the occlusion is going to reoccur because where it sits. So to prevent that, we put heparin after each treatment, whatever the length of the catheter is. Say if it says on the side 1.9 arterial, 1.8 venous. Well, we're going to draw 1.9, 1.8 of heparin and instill it in the catheter post-treatment and leave it there to help prevent that formation around there at the end of this catheter. So we talked about water scarcity, crowded transport. Now, this is all part of low resource and East Africa, specifically. Now, crowded transport. If you must travel in crowded minibus, right? Wear a mask during outbreaks, or if you have cough, fever, avoid travel to the dialysis unit if febrile, and contact your clinic before you go. Brother Moses, I'm sure you experienced riding on a crowded minibus.
Oh, yes. Our transport system in Kenya is not that much organized. In fact, I want to give you an example. If you are disabled, then we don't have public transport buses or mini buses that accommodates disabled people. So you realize that even those who have been disabled by kidney failure, like myself, you find it very difficult to find space in public transport. Besides, they are really congested. There is mad rush in getting boarding and off-boarding, because they are also chasing for clientele. The more trips the bus goes, the better, because they maximize profit on that. So yes, besides being congested, there are so many other challenges that warriors might face. And even if you opt to take a motorbike, taxi, that is, we call it border. Even if you try to go that way, it is a little bit expensive comparing to getting into a bus, because kind of motorbike taxis are much efficient in a way that you can be picked from doorstep to clinic, then from clinic back to doorstep. But then if that one is not, it is not in a way any congested, because you are only a single passenger who rides on that. Yeah. So
Wow.
that is the picture.
Okay. Okay. Let's talk about where here in the United States, they don't do this practice no more. But Brother Moses, over in Kenya, do they practice what's called reuse? This is where they reuse the filter after you finish. They take it in the back and put some disinfectant in it, rinse it out, put some disinfectant in it, and have it ready for your next treatment. Reuse practice. If your unit reprocesses dialyzers, which is this, or supplies, ask staff about cleaning, sterilization, and tracking protocols to ensure safety. Does that happen in Kenya?
I believe they don't recycle. However, the tracking protocol for how these things are disposed after use is not available, but it is now a food for a thought, perhaps homework. But I want to believe that because each time I see it is being uncovered from the wrap, but I know they can still be cleaned and packed again. But I believe that practice is normal. Yeah.
Brother Moses, you want to answer this? From P Teach, any list of ways on how to communicate with staff tactfully, afraid of backlash or tampering with my labs?
Oh, yes.
I'm sure you're outspoken. How do you get your point across tactfully to staff to avoid any type of repercussion or retaliation?
This is a very good question, P-Teach. There are ways you can speak, you can communicate politely, but very consistently. For example, if you want to address the issue of hand sanitization properly, then you wait and then respond immediately on site. The moment you see it is poorly done, then that is the time you just speak out to the health care provider, not being rude, and again, not mixing your words. You must be very straight and consistent. For example, you can question that I didn't see you sanitize. But if one insists that I've sanitized, tell him or her that you didn't do it properly. Then you let it end. So next time, he or she will be afraid, will be cautious, because the moment you throw words and then that exchange happens, then you will not be solving. You will end up in a kind of a quarrel. So it is better, even if she refuses to do the correct thing, You can also refuse not to be attended to. It is a right. So that when the case is picked up, you are able to explain why you refuse to be attended. So it will kick the conversation of what is happening, and that problem shall be solved. Yeah.
Okay. Okay. Wait a minute. Let me get back to her. So I guess I would say in some ways, one is when you approach the staff and being respectful, not screaming or hollering at them, but being, like you say, tactful. If someone you see come from another patient, then wash their hands, and they come into you, ask them, like, so and so, could you wash your hands for me before you work on me? Changing the gloves, or whatever you see that's wrong, or you feel that's out of place that could jeopardize your safety. You want to, like Brother Moses says, you want to address it quick and soon as possible. Brother Moses, talk about some other tips. Antiseptic. I'm not sure what they use in East Africa, but many clinics commonly use something called chlorhexidine or providone iodine. And if you do, follow whatever your clinic's protocol is. Avoid unproven local preparation of access site. Like if they're using a different cleanser that and you're not familiar with it, your company, your clinic's not familiar with it, don't use it. Because sometimes you got people come from other units and bringing supplies with them. HIV, TB considerations. Clinics should screen for and treat HIV, TB as needed. If you have HIV, be on antiviral therapy and disclose the care team so they can tailor infection prevention and vaccines. Now, Brother Moses, how does that work in Kenya when it comes to people on dialysis that may have HIV or Hep C or even hepatitis B? Is there a isolation room, or do these individuals dialyze in the same general population as other patients?
The policy is that each facility should have isolation room. But now, isolation room will definitely means that a separate nurse technician, a separate machine, and a separate room. Now, for a public hospital, the policy is affected because that is where the private hospitals and facilities refers patient to government hospitals, because the government is able to allocate that isolation room. But then in a private setup, most of them do not have isolation room. So when a new patient is admitted, then he must do triples. That is hepatitis B, HIV, those kind of tests, so that they get to verify that, including HIV, they get to verify that you can be placed onto any machine. Because at the back of our minds, the private sector is purely on, they are keen on profit. So instead of having maybe one patient lying with just one machine, they don't in many cases do that. So they normally refer to public hospital. So yes, there is a isolation room policy that is effective here in Kenya. Yeah.
Okay. Thank you for that, Brother Moses. Now, here's some questions that one can ask their dialysis center. How is the water used for dialysis treated and tested? How are the machines and tubing cleaned between patients? Do staff follow hand hygiene and glove procedures? Are staff vaccinated against Hep B flu shot? What is the clinic's policy on dialyzer reuse? Injection safety and screening for blood-borne infections. What symptoms should I report immediately, and how should I contact you after hours? Also, here go some signs that require urgent contact with your clinic or doctor. With your clinic or hospital. Fever, chills, redness, swelling, increase in pain or pus at the access site. If you're on PD, cloudy PD fluid or severe belly pain, and sudden shortness of breath or feeling unwell. Brother Moses, anything you want to elaborate on? We're over our time, but I'm about winding down.
Oh yes. Regarding any signs or abnormalities regarding access or any discomfort within the lower abdomen, if you are on PD, must be reported appropriately to your doctor, especially, so that you get to be reviewed, so that you get the updates of whatever is taking place.
That's it.
Sorry.
I said that's it, Brother Moses.
Yes, I was saying, for any abnormalities in access sites or pain in abdomen, if you are doing PD, or any kind of discomfort that is suspicious, then it is better to report as soon as possible to your doctor or any care team that is responsible for that.
Yeah, I agree with you.
Yeah.
Okay. Now, let me give a few more other tips. And I mentioned this before. Wash your hands before and after touching access and supplies. Keep access covered and dry. Don't touch or move it. Get recommended vaccines, Hep B, flu, pneumococcal. Watch for fever, redness, pus, If you're on PD, cloudy PD fluid, call the clinic. Also, ask your unit about water and machine cleaning, staff hygiene, and reuse policies. Now, one final note. These tips and advice are general and practical for our brothers and sisters in East Africa. As always, follow the specific instructions from your dialysis clinic or home health care provider. And with that being said, we are at the end of our show. We've been on an hour and 12 minutes. This was a great topic. Thank you, Living for Life 4010. We appreciate you, excuse me, coming by. We've been off the air for a little bit, but we started back last Sunday. So thank you for coming by. So, yeah. Brother Moses, as we get ready to end our broadcast, do you have any departing words you would like to say?
Oh, yes. I want to thank everybody who has tuned in, and even those who have not tuned in today. If you go to Stevethekidneynurse YouTube channel and the Figure Initiative Facebook page, you'll be able to follow the discussion, and hopefully you will learn at least something new. And secondly, lastly, I want to assure our viewers that we strive to provide the best. And we just started last Sunday, and hopefully there are more to come. Thank you very much. My name is Moses Kennedy, and I have been your co-host. Thank you so much.
All right. Thanks, Brother Moses. Yeah, we definitely look forward to doing this. We just need the audience to come and listen to get the information. They can always go back and see the rebroadcast of the show, but we like to answer questions in real time while folks are watching us. So with that being said, we see everyone next week with another new episode, and hopefully we can have a small crowd to engage and listen and learn to the information we have for you. With that being said, thank you everyone for watching. We definitely appreciate you. Brother Moses, has been a great broadcast. We did have a few people watching today, so I'm happy with that. And with that being said, I'll see you next Sunday. Take care of yourself during the week. Have a safe treatment on Tuesday, right? You go back for treatment. Have a safe treatment. And we'll see everyone soon. Thank you, everyone, and have a great evening. Brother Moses, have a good evening.
Same to you, Brother Steve. Be blessed.
All right. Great. See everyone later.
Hello, I'm Darren. We have breaking news. More than 600,000 Americans have kidney failure. While the number of people with kidney failure is enormous, the number of people with its precursor, chronic kidney disease, is staggering. An estimated 31 million Americans, or about 10% of the US population. Diabetes and hypertension cause 2/3 of all cases of kidney disease. 1 out of every 3 Americans is at risk for kidney disease, and kidney disease is now among the top 10 causes of death in the United States. In addition, 9 out of 10 people with early to moderate kidney disease don't know they have it, putting their health in jeopardy. Are you at risk? For more information, contact urbankidneyalliance.org. The life you save may be yours.